Hey, everybody. I'm here with PT superstar Chelsea Barnes. I'm excited to have her. She is without question a specialist in physical therapy, which an emphasis on what's most interesting in pelvic floor. And we really have to delve into that. I know we're going to talk about hip labrum. And we're really going to talk about physical therapy and why everybody needs it as a everyday kind of idea. I think you've used the example about people go to the dentist.
Yeah.
Why don't they go to the PT every month or every year and get a checkup? So
Yeah.
let's run with that.
Okay. Yeah. I mean, so something about physical therapy that I feel like a lot of people don't realize is that you don't have to be injured to go to physical therapy. You can go preventatively instead of reactively. And my biggest, kind of qualm with that is like we do so many things annually. We go to the dentist every year, we go to the gyno every year, we go to our primary every year for a physical,
Yep.
and then other things that are, bothering us, we kind of put on the back burner until it really bothers us enough to get PT. And sometimes it's, maybe
Right.
could have been avoided in the, long run. And now it didn't. And now you have to become reactive instead of preventative. And then it could be a little bit harder instead of just getting an annual assessment, looking for some weak links, some weaknesses, some strength training, some goals, and then trying to prevent injuries before they happen in the first place.
Excellent. Everybody knows I'm a chiropractor and you're a PT. And without question, we're at the middle of the bridge. We each are at the 50-yard line. So
Yep.
everybody's going to get a good vantage point. You're going to see both sides of the coin. Talk a little bit about physical therapy and their education, because I think people don't realize how well educated you are, and it's a doctoral program at this juncture.
Yeah, so I just looked this up. So I think 1996 was when physical therapists were able to get their doctorates. Up until then, it was just a master's degree. And then bridging that gap, you could do a transitional program to get a doctorate. But, pretty much majority of the practitioners out there now, myself included, have gotten a doctorate. And getting a doctorate means a lot more education. So it is, you have to take a national board exam, you have to do tons of clinical hours, like you have to really put in a lot to get this higher level degree. And that being said, it makes the profession, a little bit more easy to access and everyone has a deeper background.
Excellent. Now, congratulations. I know you have an infant. You have a newborn, correct?
I have yep, he is 7, almost 8 months old. So it's not even, it's flying by. But yeah, it has been a journey. It has been awesome. And now he is like laughing. He's about to start crawling. He's
Mhm.
on the move. So it's like the newborn days are gone and now we are on our toes.
Now, what's most interesting is that, again, we got to talk before you got on.
Yep.
Postpartum, there was a little pelvic floor issues, and it's really spurred you on to want to treat people that have pelvic floor issues. So,
Yeah.
one, what is a pelvic floor dysfunction?
So, and this is like such a loaded question. I took a course on pelvic floor, to get a pelvic floor certification, and I'm just level one certified. There are many other levels to get, but I have the bare basics and the certification for it. And a few disclaimers about the pelvic floor is that it's not just females, like males also have a pelvic floor. It is
Yeah.
like basically all of those muscles in that area, and you don't have to have had a baby or be pregnant to have pelvic floor issues. And so the big scope are things like urinary incontinence, pain with
Mm.
sex, pain postpartum. A lot of women say that when they jump they leak or things like that. That is not, people joke, oh, I've had 3 kids, I can't go on a trampoline. And it's like, while that is common, that is not normal. And just like any other
Mm.
muscle groups, it can be strengthened and it can be trained. And there is a lot of core strengthening, diaphragmatic breath work. There's a ton to do down there. What I've learned more than ever is during pregnancy and postpartum, whether you have a C-section, I had a C-section, or a vaginal birth, or however you have a baby, if you are ever pregnant and give birth to a baby in any which way, I think it should be mandated to go to pelvic floor PT because your body goes through so much. Your ligaments are, from your belly and your uterus and everything is stretched, and there's a lot of weight put on and all of this stuff. And there's a lot of trauma that goes on to your body and what it goes through. And then, the kind of rule of thumb is like 6 weeks after you see your OB, and if there's no issues, quote unquote,
Mhm.
and they're like, okay, you're cleared to return to life and exercise. And it's like, you might not really be ready for that. Like if you aren't engaging your core properly, if you aren't, moving better, I was like cleared to do this stuff. And then I tried to do just some gentle mobility stuff, ride my Peloton, go on walks. And I had a lot of hip pain. I had a lot of pain near my incision. And I was like, even though I'm a PT, I'm like, I'm not ready to just like jump back into things. Like I need a program and I need to see a physical therapist myself. And so that's when I got, so much help. Did a lot of soft tissue work, a lot of scar tissue mobilization, a lot of like tactile cues to work on my breath work on my core stability, work on my strength. And then I slowly was on a program that built up my strength so that I could return to running and return to exercise and not put myself at a high risk of injury.
I think you made some great points. One, it happens most commonly with women, but it also happens with men.
Yeah.
I think that the next point you made, which was quite salient, is that number one, it happens because of core dysfunction. So I'm going to really have you discuss that. The other one, I believe, not just core dysfunction, is hormones. So women have a loss of estrogen during like menopause. So estrogen is a critical hormone for women's muscularity. So pelvic floor, they lose their muscularity, it drops. And like you said, if they jump, they pee.
Yeah.
Same thing with men in their core. And I know you're going to go through all the exercises. Even as I age, I see the difference in my core. They say in men, the weight settles in the middle, that midriff and things of that nature. It's because our testosterone drops, and our testosterone is our basis for our muscularity. So we kind of covered the hormones a little bit, but I'd really like you to take the baton and really run with the idea of core activation, core for pelvic floor improvement.
Yeah. So hormone wise, and this is obviously not really my expertise here, but when you're pregnant, you secrete a ton of the hormone relaxin because your ligaments get ready to, become more loose and mobile, so to speak. And so a lot of women, when they're pregnant, get joint issues that they didn't have before they were pregnant, like a lot of SI joint issues, hip issues, a lot of tailbone, coccyx pain, instability. And so you just have to think about like your body, you're carrying this baby, and a lot of women have this increased lordosis, this huge anterior pelvic tilt because their center of gravity is off. And then after you give birth, it's not like you just like snap your fingers and the baby's out, but like your muscles, your ligaments, your organs, everything has been kind of shifted and displaced. And so finding like a neutral spine, being able to just get this core awareness, like especially having a C-section for me, I thought I was engaging my core. And there's a difference between engaging and like, holding your breath or bearing down and being able to take these like deep breaths, exhale, really like feel the core working. I had to do a lot of exercises in the mirror because I had to like work on that brain body connection. I had a lot of just like differentiation. I couldn't activate the muscles. It was frustrating because, for someone who's active and exercise all the time postpartum, I was like, what is going on? And then really like finding my spinal awareness. So when I'm doing exercises, like, am I compensating a ton? Am I shifting a ton? Like when I did anything, in the hands and knees or prone position, like a bird dog, a plank, anything like that, I would shift to the one side. I was kind of all over the place and I had pain with that. And so starting at the basics, like a lot of supine work, a lot of just breath work, hands around my diaphragm and just deep breaths in and out, 360 breathing, like working on desensitizing the scar. My scar was really sensitive. And so that kind of piggybacked into a lot of other core compensations. But yeah, finding that neutral spine was really key when it came to like working out again. And, working out in the mirror was helpful. I had to really start with the basics before I was able to load and add weight and run.
Wow. So you had a C-section.
Yes.
So for most
Don't
people,
recommend. No, wasn't my plan, but that's how it went.
you intended unnatural. The C-section came about. Very popular means of giving birth now. And I don't think most people realize that you are cross-sectionally getting cut in your abdomen section.
Yeah.
Those muscles don't like that.
No, 6 layers, right? 6, 7 layers of skin, fascia, tissue, muscle, like a lot.
And those muscles are the ones that hold that core in place. So here's the pelvic floor. Here's the core. If these are tight, it lifts up the floor. If these are loose because they're cut, the floor drops.
Yeah.
So it does heal as well, as a physical therapist, but it heals with scar tissue. Scar
Totally.
tissue is tight, doesn't have the ability to contract. So you have a major issue. So what
Yeah.
are some of the techniques other than the awareness, but actual manual techniques that
Yeah.
you recommend for somebody who has a pelvic floor dysfunction because of a C-section postpartum?
Yeah. So a few of the things I did that my pelvic floor PT guided me through, which was amazing. A was desensitizing it. So it is really numb and almost like hypersensitive, sometimes even like itchy. It's just like, your body kind of, it's been cut and the nerves have been cut. So a few things I always started with was like a washcloth, a dry washcloth or, a towel, just and kind of rubbing like circular motions up and down across the incision that really helped just build up sensation. Then doing similar things like, with water or lotion in the shower. One thing that was really helpful was actually cupping, not the standard traditional cupping that, we do on other joints. It was, I actually have one right here. I have them because I just washed them, these silicone cups.
Mm.
So they're really soft. I mean, I ordered them on Amazon, and you can just put it on your scar line and just kind of glide over the scar. So that helped me a ton. I couldn't tolerate a lot at first, but then I was able to tolerate a little bit more and just working on almost like pulling the scar and getting a little bit of mobility from the left to the right, up and down. And that helped a ton. And then also just not focusing on just the scar, but like your whole belly. I mean, there's a lot so just increasing the blood flow there, working on that type of stuff, that helped a ton. And it was I had to do it every day. I had to be religious with it, but it worked really well.
You brought up the idea of cupping, and
Yeah.
what you described was cupping, but not a stationary cup, but
Yeah.
one with movement.
Moving.
One
Yeah.
with movement where you're pulling what we call the body's wetsuit, the saran wrap of the body, fascia, which goes
Gotcha.
right along there, damaging the fascia. So the best way to describe fascia is if you could like literally close your eyes, everybody, and look at the chicken skin being pulled away from the chicken breast, that white film, that's fascia. When that gets cut, damaged, scar tissue ensues, and it's really hard to have the body move in an appropriate manner or a pre-cut manner. That said, great depiction that you gave where you're using the cupping and pulling it over, because Harvard University said don't keep it stationary, pull it and try not to bruise it to cause more inflammation. So
Yeah.
fabulous stuff. Now, interesting in that we both have an affiliation with Backbone and we use it regularly on our patients and lecture on it, etc. Could you explain what Backbone is, why
Yeah.
those 3 points are so vital to getting core stability, hence stimulating and the lifting of the pelvic floor?
Yeah. So Backbone has been a tactile cueing device, I guess I would call it. I joke that it's like a little ninja backpack that you can put on, and it's great. It's a great tool. I started incorporating it probably about a year ago, I would say. Prior to that, with clients and patients, I would just say, let's grab a stick or a broom and just put it on our spine. It really gives you this like tactile awareness for like where your body is in space. And so the 3 points that I emphasize are the back of your head or your skull, your between your shoulder blades or between your scapula, and then your tailbone. And so you want to find this like neutral alignment position between these 3 points where you have to sometimes do a little bit of a chin tuck, sometimes adjust the rib cage, oftentimes tuck or tilt your pelvis to find this awareness. Now, finding a neutral awareness, like when you're just standing or walking or sitting, is not as difficult as doing it functionally. So when you are exercising, riding a Peloton bike, deadlifting, hinging, all of the, squat, hinge, lift, that type of stuff. So when I ended up giving Backbone a try, I was like, this is genius because I don't have to have my hands behind my back holding a stick. I can have my hands free and have this cueing device on the back of my head between my shoulder blades and touching my sacrum or tailbone area and getting that like tactile feedback while I'm holding a weight or lifting something and hinging and things like that. And when you have that neutral spine awareness, it is much easier to breathe better, use your core more, really activate your core to its like full ability and not be overcompensating with a huge arch or, putting yourself at maybe even a higher risk of injury with an excessive arch or excessive rounding or, lifting with core mechanics. It's a great, device to use in conjunction with all the other functional things.
So for the women listening, Give them three cue. Obviously, they should go to a PT who specializes in pelvic floor work.
Go to a PT. No.
We've established that, and I concur. In that, give three exercises that they can do today to try and improve their pelvic floor. And
Okay.
I'm going to press you. Give me
Okay.
three exercises that the men can do for their pelvic.
Okay. So like, I guess my quick hot take on that is that it doesn't have to be different, the men versus
Okay.
the women, because really, like, anatomically there's a little bit of a difference, but you're still doing the breath work and the diaphragmatic breathing and getting everything to activate. So one of the arguably easiest, but I think hardest, is just that 360 breathing. So you can do it laying down, sitting up. I like to just put my hands on my rib cage on the front and the back, really like my thumbs on the back of my, ribs, my posterior ribs, and just take a deep breath out and then in, really focus on like a deep, full belly breath. It is harder than it looks to do, like, a deep inhale, hold for a few seconds, followed by an exhale. I am very much a upper trap like breather. And I notice when I run or I get tired exercises, I breathe a ton into my chest or my traps. I really don't do a good job expanding my ribs or expanding my belly. And so that can have, a little bit of a ripple effect on the way that I exercise, work out, and recover. So 360 breathing, one of my go-tos. I think it's excellent, and it's more challenging than you think. If you want to piggyback off that, I like to do a little balloon. So an empty balloon, and you could take a deep breath in and then exhale into the balloon. It is great, a little humbling for activating that whole core, transverse abdominis, rectus abdominis, all these core muscles firing up. Another one I love is just like a modified or a full dead bug. So on your back with your knees, bent up to 90 degrees, like to just start with the knee taps or the heel taps, and just dropping the knees down, really keeping the core engaged and not overarching the low back, like really trying to keep that tuck, keep it flat, and then slow control, dropping the heels down. If you want to make it harder, you can incorporate the arms where you're doing the opposite extension. One leg goes down, opposite arm goes down. And then I guess if you want to make it one step harder, going in the hands and knees position. So they're all names: dead bug, bird dog, it's all animal names. So bird dog, another great one. One cue with that is if you don't have a backbone, I like to just put like a foam block or something on the low back while I do those on hands and knees, working on the extension and the arm and the leg at the same time. But I like to put something, sometimes I even put a water bottle on people's back, just to make sure that when you extend and you shift from one side to the next, that you're not leaning and shifting. And then obviously if the water bottle or the foam block falls off, then you're having way too much of a shift, and you need to work on keeping that neutral spine and the core engaged and having your, primary core hip trunk stable, and then being able to move the upper and lower extremities without a lot of shift.
Fabulous. I love those exercises. And you're right. Yeah. The name is inherent in what you have to do.
All these animal names.
Yeah, it's great. You have a family member that's
Yes.
a professional athlete.
Yes, my husband.
Yes. And he suffers from an injury that you and I were conversing about before. It's called a hip labral tear. Now, first off, 10 years ago or 12 years ago, there was no such thing as a hip labral tear. Now it is without question the hottest thing since sliced bread. In any case, it exists. You and I both see patients that have hip labral tears. Some people need surgery. Some people don't. I think to have a good clarifying discussion on hip labral tear, none better than you, dealing with a professional athlete 24/7, 365.
Yeah.
What is it? What are we talking about with the hip labral tear?
So the labrum, and you have a labrum in your shoulder and your hip. So basically hip and shoulder are both ball and socket joints. And so the labrum is essentially, the cartilage there. That's the outer rim of the hip joint, so to speak. Personally, and I can say this, my husband went this route for 5 years until he eventually needed to get surgery on it, unfortunately. And that was more due to his profession, because he really never gave it a true rest, so to speak. He was constantly on it. He's a pitcher. And so it was, a one-sided thing for him. But for 5 years, and this is, I prefer the conservative approach as a PT, if we can.
Same here.
It depends on where the labral tear is. So it could be on the bottom cusp, the top cusp, the middle, and depending on the intensity of the tear and how big it is, you're going to have pain in different arcs of movement. However, I always try to, go conservative. PT can work wonders on it. There's a ton of manual therapy techniques. You can work on glute strengthening, hip mobility, all that type of core stuff, to try and rehab it yourself. And there is still a likelihood that if it's torn, obviously it is going to stay torn. And so you may be able to aggravate it with certain activities, with really deep squats, with really, heavy movements. But a lot of people are able to rehab it almost back to, 90, 95% without needing surgery. But, of course, there's always a handful of cases where, unfortunately, surgery may be the only true option to really fix it. In my husband's case, that was his option. He was able to buy a lot of time, but when push came to shove at the end, he ended up having a lot of pain where it wasn't just affecting him in baseball, it's affecting him like in his daily activities. I mean, he had a little bit of a limp walking around, a lot of pain, and he just couldn't get over the hump. And from a conservative standpoint, he did try PRP injections and all these other types of things to try to get it, under wraps more conservatively, but unfortunately he just needed to have it surgically repaired. And then that obviously set him back a little bit. But since then he feels great, and he had to put in his time with rehab. Surgery is not the quick fix. So that took a while to get back to his now status, but he's doing good. So
That's great to hear. It's an interesting point you just made. You have to rehab whether they have a surgery or not. So people think, oh, I'll get a surgical intervention, and there's nothing wrong with that.
yeah.
But, I just get up and I run a marathon the next day, and that's not necessarily the case.
Yeah, I think a lot of people, I've had patients be like, oh, I met with my surgeon and they said it's a routine procedure that takes 30 minutes. Not the labrum per se, but just a surgery in general.
Right.
And I'm like, yeah, for them, like that doesn't mean you're going to be in and out in 30 minutes. You are going to be out of the surgery in 30 minutes. But it's a lot of rehab on the back end of a lot of orthopedic surgeries. And so my emphasis with friends, family, patients is just, if you need surgery, of course, surgery exists for a reason, and there is always a time and place for that, thankfully. However, it is not the easy way out. And I always recommend, even if you need surgery, to do some sort of like pre-PT, pre-surgery PT, prehab, if you will, just to gain your strength and gain your mobility. Because if you come into surgery here versus here, you're going to have better outcomes if you go in a little bit more prepared, and you're used to putting in the time and effort 2 or 3 or 4 times a week, like an hour plus a day. We're really trying to work on that mobility and strength to get you over the hump of actually making progress.
I want to piggyback on what you said about the prehab, because
Yeah.
I do believe that that's a critical element. Again, people say, well, I'm going to have surgery. It's like, are you prepared for surgery? You're going to get cut. No one's anti-surgery here, but you're going to have the best outcome if you're in the best shape prior to surgery. One of the fortunalities of going for a planned surgery is the ability to prehab, like you said.
Yeah.
To see a physical therapist. And I'm going to, of course, inject chiropractor, but sorry if I'm biased.
Oh, totally.
Let's do it. And also one of the things that I found work really well for labral tears pre and post surgery is low-level non-thermal laser. It's one of the devices that I like to use a lot. Now, my question is, how long was his prehab? I know you said he had a 5-year, and how long has his post-hab been with the labral?
Yeah, so prehab, and I will say, like, he had been so fortunate working with, MLB has tons of resources. He did everything. I mean, any type of conservative therapy with cupping, dry needling, laser, cold tubs, saunas, massage, everything. He did it, and it was great, and it helped often and regularly, and bought him a lot of time. But obviously it got to the point where he was still pitching on it every day. And so eventually it got aggravated enough. So it did buy him probably 5 years. And if he wasn't still playing professional baseball, he likely would have not had it surgically repaired. But for him to compete at this level, he needed to have it done in that aspect. And then post-op, it took him, I would say it took a good 4 months for him to get back to, I would say 3 months for him to get back to like life activities without any issues, like no limping, no discomfort, no, stairs, all that type of stuff. But to get back to like more sport specific activities, baseball, throwing, that type of stuff, that started around, I would say 4 months. And then took him another 2 or 3 months he went to PT religiously, not me, someone else, 3, 4 times a week. He spent hours and hours and hours rehabbing, doing stuff for it. He was religious about it. And he got to the point where, it ended up being almost back to normal, if not better. So it worked out very well, but a lot of hours put in.
Not to belabor the point, he is a professional athlete.
Yeah, so
differently than regular guys like myself.
That's his job.
He's also a good age. He's under 35 when this is occurring. He's not 55, 60, which really segues to the next question. In your practice, have you seen a lot of these labrums where people say, you're 55 to 60, you're a male, I don't want to do the surgery, I'm just going to wait for the joint replacement?
Yeah. And I have a lot of people, they come in and they've had knee or hip pain for many years. And they're like, oh, I'm just kind of waiting until I get it replaced. I'm bone on bone. And, I always say if it's inevitable, then of course surgery exists for that reason. And that's great. And we'll hit that course of action when we get there. But in the interim, it's like, if you are having pain in your hip or in your knee and you have any underlying issues like PT, chiro, there are a lot of other conservative approaches and a lot of things you can do for pain relief.
So let's switch the channel a little bit. Yeah. You and I both have agreed that COVID changed the way that people access their healthcare practitioners.
Yeah.
Virtual meetings, virtual PT has grown. So I know you want to make a big statement on how you can benefit from virtual PT.
Yeah. So I would not have been one a few years ago to say that you could do virtual PT because as a PT myself, it is often a very hands-on practice, with all of this manual stuff that we just talked about, soft tissue work, cupping, dry needling, that type of stuff. It seems difficult that you can do virtual PT, but after COVID, we started doing a lot more telehealth through my old company. And I hopped on the bandwagon because I'm like, wow, this really does work. I was working at the time with a lot of high school athletes, and during telehealth sessions, we would hop on these calls and I would be like, show me how now that you're home, show me how you're doing this exercise. And they would run through an exercise. And I'm like, wait, that's not where you need to have the band anchored. Do you have why don't you go to the door over there? Why don't you put the band there? And I could actually see them in their natural environment, natural habitat. I was going to say, sounds like an animal, in their natural environment. And it was really easy for me to correct them and give them better cues so that their form was better, that they were doing it in a, better environment. And then I was like, there's a time and place for this. So then a few of my friends that at the time were pregnant, they were having some issues and I was, in a different state from them. They were like, let's hop on a virtual call. And I was like, it's easier for me to just demo an exercise instead of talking you through it. It's very hard to talk through an exercise. It's easier for me to give a demonstration, have them do it, and then me give some feedback. And that's where I was like, this is so helpful. So started with just my friends, then went to some telehealth stuff. And now I'm doing it very often with patients, clients from all over the country. I will say a perk to virtual is that since my clients, patients are not relying on me doing manual therapy stuff, they are putting in the work themselves. And I always say outside in is a temporary gain and inside out is more long-term. And so total disclaimer, there is a time and place where I don't think virtual is appropriate. I think if you had surgery, if you have acute pain, you should see someone in person. And I definitely steer people in that direction. But if you're dealing with more of a chronic issue or you're just not ready to get back into running or exercise and you're there but not there enough and you still need some guidance or an exercise program, things like that, I think virtual can be extremely beneficial.
I personally like the virtual myself, certainly for the nutrition, but I agree with you for the PT. It's a great adjuvant to all other type of treatments. And if they want to get somebody who's an expert like you,
yeah,
and they're in Colorado, let's say, and you're in Connecticut,
yep,
correct?
Yep.
There are some people that have the wherewithal to fly, but the general population is not going to fly to see someone from Colorado to Connecticut. So they have access, like we're doing, virtual Zoom. Now, one of the biggest questions I get, do you have to see a physical therapist? Because people are really focused on the idea, sometimes myopically, on the concept that PTs are just rehab practitioners. So do you
Yep.
have to be injured to see a PT?
No. And so that's another huge scope of mine. It's like you don't have to be injured or have, like, the vast majority of people definitely go to PT to rehab some sort of chronic or acute injury, but PT can really help you just avoid an injury in the first place. So when it comes to things like balance, I think is a huge preventative issue that PTs work on a lot. Any sort of asymmetry, weakness, if you like to do CrossFit, if you are a marathon runner, like, you don't have to wait until you possibly get an injury to go to PT. Like, you can go to PT and do general functional assessment. So with a lot of my clients, whether it's in person or virtual, I have them run through the functional assessment. So a squat, a hinge, a lunge, a deadlift, single leg stance, and go through mobility, thoracic mobility, lumbar mobility, everything. Like, how are we moving? Does this have pain? Does this side feel tighter than the other? And if you can hone in on some restricted areas or areas of weakness, it's like, hey, your left side is a lot weaker than your right side. Let's run through X, Y, and Z, get you on a program to kind of address these instabilities or these weak links and strengthen them while you are doing marathon training or just workout classes or just living life, and get you so that you're feeling better before this ever becomes an issue.
Now, you're the owner of a virtual business called B, like the letter, on the
Like the
move.
yes. Yep.
What's that all about? I mean, movement is key to health. Movement is a key to life. Movement reveals all our health injuries over duration of time. You and I and everybody else, we may forget an injury, but our movement pattern will reveal that injury to everybody. So why don't you
Yeah.
go into a little bit of detail about Be on the Move and how to improve movement?
Yeah. So I came up with the name because I always, my phrase is always movement is medicine. And so it's always like, if you have a joint issue, if you are even having a bad day, I'm like, get outside and go for a walk. Like, to me, really, movement is the best medicine. And so my name came to be because I want to do something with our last name, Barnes, and be on the move. I just always say, you got to get on the move. So easy, short, quick, easy. It's catchy.
Now, you have a pretty big online course called Get Your Back on Track.
Yes.
So why don't you tell people how they can access it, what
Yeah.
it comes with, what's your baseline for it, etc.
Totally. So after doing so much virtual stuff, so many virtual clients and meetings and posting stuff on Instagram, once I realized that, there was an audience for this and people love these videos, these short 10, 30-second Instagram reels, but they're not maybe the best to follow because they're quick and they're sped up and they're done to music. It was like, what I think would be more beneficial, and I started this with actually just a lot of my clients, was starting a library. And so when they did their home program, they were able to just access this library of videos, of pre-recorded videos, where I have almost 30 different activities of me running through standard exercises. So a lot of mobility, a lot of strength stuff. And instead of just running and demoing it really quickly, it's me talking through it, explaining it, telling them how to advance it, how to make it harder, how to make it easier, what they should be feeling, that type of stuff. And so once there was more of a demand for that, I realized that it doesn't, I don't have to just be seeing you privately for you to get access to these videos. So I started this online course called Get Your Back on Track. It is pretty, I would say, basic and self-explanatory. And I made it that way for a reason, so that you don't need any equipment. You don't need, fancy gym equipment. You don't need to leave your house. But if you're looking for just, like, to me, the functional and basic mobility and stability drills, there's an ebook included in that, so you can run through, a little self-assessment, injury prevention guide, and then you can access these videos whenever you want. So you can do all of them if you wanted in one day, or you could break it down and do 2 or 3 videos a day. I give people access to it for a full year, and so it's just a resource from a PT. It's based on, everything on there is evidence-based and it's corrective exercise, and there's no, treatment of anything, but it's just general movement, instead of YouTubing or aimlessly scrolling Instagram and just trying to find, like, hip pain reels. It's like just I wanted to be a resource for people so they could have something in one place. And so the course has done great. People love it. I still get messages about it. And then I do always offer free consults to people that use it. So if they have questions about it, we hop on a call. And it's been a great way to really hit a bigger audience of people.
I agree. I think that the social media has some real positives. Like you
Yeah.
said, 10 to 30, 20 seconds of an exercise with music looks
Yeah.
enticing, but does it go into detail to really allow you to understand how to do the exercise right for you? Good point. So
Yeah.
let me give you a scenario. I injured my back. I injured my shoulder. My neck is a little stiff. So I went to my primary care physician, and he or she wasn't really sure. So they said, let me go to an orthopedist. And the orthopedist did not refer me to anybody, said it's not surgical intervention. So you know what I did? I went and I got a massage. And you and I are both sitting there going. So at what point should they know to go to the physical therapist first?
So that's another one of my, besides movement is medicine. I like to say, choose PT first. That's like, I think a nice little slogan too, or Chiro. And the biggest reason for that is that it's cost effective and like we're experts in this type of stuff. So instead of, doing that roundabout and not either getting the treatment that you need or spending a lot of money on things that are going to get you to PT anyway, it's like you don't have to go right to your primary care physician and wait for a script. And then they could possibly send you to get an x-ray that you might not necessarily need at the time, or an injection or something like that. Then maybe even refer you to an orthopedic who's going to say, oh, you're not a surgical candidate. Why don't you try PT anyway? And it's like, you could have maybe just went to PT first and got evaluated. And PTs can definitely, if there's red flags, like I'm happy to send you back to your primary for an x-ray, or send you to an ortho if I think, you absolutely need imaging done. But I always recommend PT first is usually the cheapest route and the best route. I think there was a study that says if you choose PT first, you can save like almost $5,000 instead of going the alternate route of seeing a bunch of other healthcare providers. The average PT cost is probably like, it ranges by state, of course, but $75 to $150 a session versus seeing your primary, then having an x-ray, then seeing a specialist, then going to PT down the road. It's like, just start here first.
So I always like to end with a couple of quick things. I like to end with what we call a rapid fire.
All right.
So are you ready?
I'm ready.
Are you put your seatbelt in? You got your
Yep.
helmet on? Here we go. Sit-ups, yes or no?
I have a better alternative. No.
Okay.
I like to do sit-ups with something behind your back. So I love to use a Pilates ball on the low back. And then it's a really, really humbling, harder version where you push your low back into the Pilates ball, really bring that belly button to spine. It is like next level core activation. And most of the time when people do sit-ups, they just use their hip flexors and momentum, and they're not really engaging the core. So sit-ups with a Pilates ball, yes.
Okay. Ultrasound, electric muscle stim.
No. Do you want me to expand or just say yes or no? I think there's a time and place. I've never been an ultrasound girl. Electric stim, I've never been a huge e-stim girl unless someone is in such acute pain that they can't tolerate any exercise. Then I'm okay using stim in conjunction with some heat or ice to get them so that they could tolerate some manual therapy or some movement.
McKenzie extension.
Yeah,
core
I think
activation.
Or what?
Core activation.
Oh, whew. I would say core activation. I think McKenzie works excellent, but doesn't work on everyone, the techniques. But I think core activation is a general foundational thing that everyone, it would work on.
Best exercise for hip labral tears.
Ooh, I love, well, since we have pain, but mobility, my favorite is a hip car, controlled articular rotation, standing and moving the hip in all sorts of movement without cheating and using your low back. I have a lot of videos on my Instagram if anyone wants to see that. And some sort of glute or single leg stability. I love like a wall clam, so a leg against a wall, or a reverse lunge, I would say are my two favorites.
Favorite diet for your PT patients?
Ooh. See, it's hard. I'm not It's not my scope, obviously, but I try to stick to low inflammatory. So high protein and low inflammation. Those are my bare basics. Lots of water, lots of protein. That's my go-to.
Last one before we end. What's next for Chelsea Barnes?
Ooh, so my 5-year plan. Now this is a little, I have a son, obviously. My husband is still,
Rads.
on the move here. But 5-year plan is to open up a brick and mortar location. So starting to explore some options for a brick and mortar office in Connecticut. I will still always do virtual because I think it's amazing and I can hit such a broader audience, but I do love treating locally and a lot of manual stuff. So I would love to have the best of both worlds.
What can I say? It's been fast. It's been furious. It's
Love
great to have a like-minded person on. Tell your husband, I hope he feels well. We want to see him back on the diamond as soon as possible.
Yep.
Anybody needs to see you, everything's in the show notes. I'm Dr. Rob Silverman, Proven Health Alternatives, always yours in health.
Thank you.
My pleasure.